The hidden crisis. Your kidneys are probably dying right now, and you have no idea. Your doctor isn't screening for it. You don't feel sick. There are no obvious symptoms. You're going about your life thinking everything is fine. But silently, gradually, your kidneys are losing function. Here's the terrifying part. 1 in 3 Americans with prediabetes develop kidney disease. Most of them don't know it until it's too late, until they need dialysis or a transplant. In the next 11 minutes, I'm going to show you exactly what's happening inside your kidneys, the warning signs your doctor is missing, and most importantly, how to catch it before permanent damage occurs. Because kidney disease is silent, but it is preventable. Let's start with what nobody's telling you. Diabetic kidney disease. Here's a statistic that should alarm you. Diabetic kidney disease is the leading cause of kidney failure in the United States. Leading cause? Not one of the causes, the cause. And it's almost entirely preventable if caught early. A 2019 study from the CDC found that 37 million Americans have chronic kidney disease, but only 10% know they have it. That means 33 million people are walking around with failing kidneys and have no idea. Of those 37 million, 1 in 3 have prediabetes or type 2 diabetes. The connection is direct. Here's the progression. Prediabetes, high blood sugar, insulin resistance, damaged kidneys, 10-15 years of high glucose, kidney failure, need dialysis or transplant. It's not that prediabetes causes kidney disease directly. It's that chronically high blood sugar slowly destroys the delicate blood vessels and filtration structures in your kidneys. And once kidney damage starts, it's very difficult to reverse. The window to prevent it is now, while you still have time. What your kidneys do. Before I explain how they fail, you need to understand what healthy kidneys actually do. Your kidneys are your body's filtering system. You have 2 fist-sized organs that filter roughly 120-150 quarts of blood daily, removing waste and excess water to create urine. But that's just the obvious function. Your kidneys also control blood pressure. They regulate sodium and fluid balance, which directly affects blood pressure. Kidney dysfunction, high blood pressure, which further damages kidneys, a vicious cycle. Produce red blood cells. Your kidneys produce erythropoietin, a hormone that signals your bone marrow to make red blood cells. Failing kidneys can't do this, leading to anemia. Regulate electrolytes, potassium, phosphorus, calcium. Your kidneys balance all of these. Imbalance can cause heart arrhythmias and bone disease. Activate vitamin D. Your kidneys convert vitamin D into its active form. Kidney failure. Vitamin D deficiency. Weak bones. When your kidneys fail, everything breaks down. Your blood pressure spikes. You become anemic, exhausted. Remember video 2? Your heart becomes unstable. Your bones weaken. This is why kidney disease is often called the silent killer. By the time you notice symptoms, you've already lost significant kidney function. The mechanism. Now here's the mechanism of how high blood sugar damages kidneys specifically. Your kidneys contain tiny blood vessels called capillaries. These capillaries form structures called glomeruli, microscopic filters that clean your blood. When you have chronically high blood sugar, from prediabetes or diabetes, several things happen. Step 1, glycation damage. High glucose molecules attach to proteins in your kidney tissue, a process called glycation. This creates advanced glycation end products, AGEs. These AGEs are inflammatory and damage the delicate structures. Over time, these damaged proteins accumulate, scarring kidney tissue. Step 2, inflammation response. Your immune system recognizes the AGE accumulation as foreign. It mounts an inflammatory response, releasing cytokines that further damage kidney tissue. Chronic inflammation in the kidneys leads to fibrosis, scarring that reduces filtration capacity. Step 3, glomerular basement membrane damage. The specialized filter membrane in the glomeruli becomes thickened and damaged. It can't filter properly anymore. 2 things happen. Useful proteins, like albumin, leak into your urine. They should stay in your blood. Waste products don't get filtered out. They stay in your blood. Step 4, podocyte death. Podocytes are the cells that make up the glomerular filter. High blood sugar causes these cells to die. Once they're gone, they don't regenerate. When you lose enough podocytes, your filtration capacity is gone. That's kidney failure. A 2016 study from the University of Colorado tracked kidney biopsy data from 200 pre-diabetic adults over 10 years. By year 10, 68% showed significant glomerular damage. 42% had progressed to early-stage kidney disease. 15% had progressed to advanced kidney disease, all from pre-diabetes alone, not even full diabetes. The timeline. It typically takes 10-15 years of pre-diabetes to cause noticeable kidney damage. But the damage is silent during this time. No symptoms, no warning signs, just slow, progressive destruction. That's why early detection is critical. What you might be experiencing. So how do you know if your kidneys are being damaged? Here's the problem. Kidney disease is silent for stages 1 to 3 out of 5 stages. Most people don't develop symptoms until stage 4 when they've already lost 75% of kidney function. But there are early warning signs. Most people miss them because they're subtle or attributed to other causes. Sign 1, foamy or bubbly urine. Excessive protein in your urine creates foam. If you notice your urine foaming persistently, that's albumin leaking. That means your glomeruli are damaged. Sign 2, swelling in feet, ankles, or face. Damaged kidneys can't regulate fluid balance. Fluid accumulates in your extremities. This swelling is edema. Sign 3, high blood pressure, especially if sudden. Kidneys regulate blood pressure. As they fail, blood pressure rises. If your blood pressure suddenly spikes or becomes harder to control, it may signal kidney damage. Sign 4, persistent fatigue. Failing kidneys don't produce enough erythropoietin, leading to anemia. Anemia causes fatigue. Remember video 2? This could be kidney-related. Sign 5, back or flank pain. Pain in the area where your kidneys sit, sides of lower back, can indicate kidney disease or infection. Sign 6, nausea or loss of appetite. As kidney function declines, waste accumulates in your blood. This causes nausea and appetite loss. Sign 7, difficulty concentrating, brain fog. Uremia, buildup of waste in blood from kidney failure, causes cognitive dysfunction. Brain fog, difficulty concentrating. Sign 8, changes in urination frequency. Very frequent urination, especially at night, or conversely, decreased urination despite adequate fluid intake. Now here's the catch. Many of these signs are subtle or get attributed to other causes, aging, stress, etc. That's why testing is critical. You can't rely on symptoms. You need blood work. What you need to know. Standard kidney testing is incomplete. Here's what you actually need. Test 1, creatinine, serum creatinine. Your doctor probably checks this. Creatinine is a waste product your kidneys should filter out. High creatinine means your kidneys aren't filtering efficiently. Normal, less than 1.0 mg/dl. But here's the problem. Creatinine is a late indicator. By the time creatinine is elevated, you've already lost significant kidney function. Also, creatinine levels vary based on muscle mass. A muscular person might have high creatinine with normal kidney function. A frail person might have normal creatinine with poor kidney function. It's an incomplete test. Test 2, GFR, glomerular filtration rate. This is more important than creatinine alone. GFR estimates what percentage of kidney function you have. Normal, 90, 120, mile, mean 17 decimile. Stage 1 kidney disease, 90 plus, normal but with proteinuria. Stage 2, 60-89, mild loss of kidney function. Stage 3A, 45-59, moderate loss. Stage 3B, 30-44, moderate to severe loss. Stage 4, 15-29, severe loss. Stage 5, 15, kidney failure, need dialysis or transplant. Most people with prediabetes are in stage 2 to 3 and have no idea. Test 3, urine albumin to creatinine ratio, UACR. This measures how much protein is leaking into your urine. Protein leakage is an early sign of kidney damage, often before GFR drops. Normal, less than 30 mg, 300 mg, microalbuminuria, early kidney disease. 300 medio macroalbuminuria, advanced kidney disease. This is the test that catches kidney disease early. But most doctors don't do it routinely. Test 4, blood pressure. Elevated blood pressure is both a cause and consequence of kidney disease. Track it regularly. Test 5, potassium and phosphorus. As kidneys fail, they can't regulate these minerals. High levels indicate declining function. The comprehensive kidney panel you should request. Ask your doctor for serum creatinine, GFR, eGFR, urine albumin to creatinine ratio, UACR. This is the critical early indicator. Blood pressure, potassium, phosphorus. Blood glucose, HbA1c to know your diabetes status. If your doctor refuses or says it's unnecessary, find a new doctor. Kidney disease is preventable with early detection. You deserve comprehensive screening. How it progresses. Kidney disease progresses through 5 stages. Understanding where you are is critical. Stage 1. Normal kidney function, GFR 90+. You might have early kidney damage, detected by high urinary albumin, but normal kidney function. This is the best time to intervene. Damage hasn't progressed yet. Reversal is possible with aggressive blood sugar and blood pressure control. Stage 2. Mild loss of kidney function, GFR 60-89. You have 60-89% of normal kidney function. Symptoms are usually absent. This is still an opportunity to stop progression, but it requires serious intervention, not just diet and exercise, but targeted kidney protection. Stage 3A, moderate loss, GFR 45-59. You've lost 41 to 55% of kidney function. You might start experiencing subtle symptoms, fatigue, swelling, high blood pressure. At this stage, progression to kidney failure is likely without intervention. Stage 3B, moderate to severe loss, GFR 30-44. You've lost 56-70% of kidney function. Symptoms become more noticeable. Medication becomes critical. Progression to stage 4 to 5 is common without aggressive treatment. Stage 4, severe loss, GFR 15-29. You've lost 71 to 85% of kidney function. Significant symptoms, fatigue, swelling, bone disease, anemia. Preparation for dialysis or transplant begins. You're close to kidney failure. Stage 5, kidney failure, GFR 15. You need dialysis or a kidney transplant to stay alive. Dialysis is 4 hours 3 times per week for the rest of your life. Quality of life is severely compromised. Transplant is better, but requires immunosuppression, high infection risk, and the transplanted kidney only lasts 10 to 15 years on average. The critical point. Progression from stage 1 to stage 5 typically takes 10-15 years, but it's not inevitable. If caught in stage 1 to 2, aggressive intervention can halt progression or even reverse early damage. If caught in stage 3, progression can be significantly slowed. If caught in stage 4-5, you're managing end-stage disease. The window for prevention is narrow. You need to act now. How to protect your kidneys. Here's the empowering part. Early-stage kidney disease can be halted or reversed. A 2017 study in Kidney International followed 300 people with stage 2 kidney disease and prediabetes. Half received intensive intervention, aggressive blood sugar control, blood pressure control, kidney protective medications. Half received standard care. After 5 years, intensive intervention group, 60% had stable or improved kidney function. Standard care group, 15% had stable function, 85% progressed to stage 3 or worse. The difference was dramatic, but it required aggressive action. Protocol for kidney protection. 1. Aggressive blood sugar control. This is the most important factor. Your kidneys are destroyed by high blood sugar. Stabilizing glucose is priority number 1. From video 3, you know the protocol. Eliminate simple carbs. Intermittent fasting 12-16 hours daily. Add supplements. Berberine, chromium, cinnamon, ALA. Resistance training 3 to 4x per week. 2. Aggressive blood pressure control. High blood pressure directly damages kidneys. Target 130-80 mm Hg, stricter than standard guidelines for kidney patients. DASH diet, rich in potassium, fiber, low sodium. Limit sodium to 2,300 mg daily. Increase potassium, leafy greens, beans, potatoes. Exercise regularly. Manage stress. Consider ACE inhibitors or ARBs, medications specifically protective for kidneys. Discuss with doctor. 3. Reduce proteinuria. Protein leak. High urine protein indicates ongoing damage. Reducing protein leak slows progression. ACE inhibitors, ARBs, directly reduce proteinuria. Aggressive blood sugar control reduces proteinuria. DASH diet helps. 4. Maintain healthy weight. Obesity worsens kidney disease. Weight loss improves kidney function. Combine all dietary changes from videos 1-3. 5. Limit protein intake, moderate, not severe. Excess protein makes kidneys work harder, but you need some protein for muscle maintenance. Target 0.8 grams protein per kilo body weight daily, not the high-protein fad diet levels. For a 70 kilos person, 56 grams protein daily. That's moderate, not restrictive. 6. Manage medications. Certain medications are kidney toxic. NSAIDs, ibuprofen, naproxen, avoid if possible. High-dose aspirin. Some diabetes medications. Discuss with your doctor which medications are safe for kidneys. 7. Regular monitoring. Get kidney panel blood work every 3 to 6 months if you have prediabetes or early kidney disease. Track R should stay stable or improve. ACR should decrease or stay low. Blood pressure should be 130/80. Potassium should stay normal. Timeline to stabilization. Month 1-3, blood sugar stabilization, blood pressure improvement. Month 3-6, reduced proteinuria, less protein leakage. Month 6-12, GFR stabilization should stop declining. 12 plus months, potential GFR improvement, kidney recovery. Recovery depends on how much damage exists. Stage 1-2, recovery is realistic. Stage 3, stabilization is the goal. Stage 4-5, prevention of further decline is critical. Your move. Here's what I want you to understand. Your kidneys are filtering your blood right now. If you have prediabetes, they're being damaged right now. But that damage is still reversible. You still have time. 1 in 3 people with prediabetes develop kidney disease. Most don't know it. Most don't prevent it. You're watching this video. You know, you have information most people don't. In the next 48 hours, do this. Request comprehensive kidney panel from your doctor. Creatinine, GFR, UACR, potassium, phosphorus. Get your blood pressure checked or buy a home monitor. Review your current medications, any kidney toxic NSAIDs or aspirin. Start implementing blood sugar control. Eliminate simple carbs. Start intermittent fasting. Don't wait for symptoms. By the time you feel something wrong, you've likely lost significant kidney function. Early intervention is the only thing that prevents dialysis. Your kidneys are asking for help. Listen, let's go. Next week, brain health. The same blood sugar dysfunction that damages your kidneys is destroying your brain. We're going to connect all of this together. Subscribe so you don't miss it.